before any treatment?
Well, that's a good question. It's not really a complicated answer, but we know that if any injury occurs, the healing process goes much better with fewer side effects, less significant permanent residual defects if the skin was healthy to start with. And we can look back to little babies with cleft lips when they are still in the uterus before they're born, and you know there's a cleft lip. The surgeon can go and do surgery while that little baby's inside, and all it is one stitch to glue those edges together. And when the baby's born, the lip's normal. So the earlier in life we start to look at skin, the more healthy it is. And as we get to be 60 years old, we've really lost a lot of that healing power. So doing things purposely for skin before you injure it with a procedure like microneedling or dermabrasion or chemical peels, then it's going to get well quicker with a better result.
Perfect. So talk about the effect in regards to prepping healthy skin versus unhealthy skin. So what is going to be the side effect post-procedure if we do prep the skin versus if we don't prep the skin? Tell us about that.
Well, it's not really a side effect. The objective is to get the best result you can get. And if you prep the skin ahead of time, that's the side effect that you're going to get is an excellent, wonderful, couldn't be better result. If you don't prep the skin, several things can happen. One, you can get abnormal pigmentation through the healing. We call that post-inflammatory hyperpigmentation. You can get minor residual scarring that may need some small touch-up. It certainly would require the esthetician, nurse, or doctor to have more hand-holding time, maybe see that patient an extra 2 or 3 times in the office during the healing process. Right. We don't like that. We like things to be perfect.
Right. So it minimizes the complications.
Absolutely.
Prevents first reactions. And it's also giving you the opportunity to build that relationship with your client so that they're more compliant, because the more involved they are in their skincare routine, their take-home daily skincare routine, and prepping the skin during that process, they're going to see the change, the result of, hey, man, I've only been using these products for a couple of weeks and I can already see my skin changing because it's becoming balanced and stable. So if the skin wasn't prepped properly and they didn't follow the protocols and the guidelines, what's something that we would see and as far as like a negative effect of that? Like, talk about the other end of the spectrum.
Well, for example, if you're doing a deeper peel, a TCA 30% peel, for instance, would be pretty much taking all the epidermis off down into the upper dermal layer of things. If you didn't prep the skin ahead of time, that I would expect to see some healing still going on, some still unreepithelialized areas at 8 to 10 days. Prepping the skin, certainly with the protocol that we use in the pre and post care, we can shorten that 8-day period down to about 5 days. If you don't use the preparation of skin ahead of time, in other words, the conditioning of skin ahead of time, you may even see longer delays in healing than the normal 8-day or so for those deeper peels. And if it stands to reason that if you can prevent, if you can optimize the result of a deeper peel, a greater injury, why not use the same protocol on everything, even if you're doing just a superficial lactic acid peel or a Gessner peel?
Exactly. So how long should a patient prep their skin before any skin treatment? What's standard?
I think the minimum should be a couple of weeks to get optimum outcome. Now,
Totally.
obviously, I see patients from, I'm not in practice now, but when I was in practice, I had a couple of patients come over from France. So you get folks a long way off. They don't want to come see you and stay 2 weeks and wait and have a facelift and a procedure, but you want their skin to be as healthy as it can be. So those products they can use at home can be used in France or New York or California or somewhere else, and then come to, in your case, Tennessee, my case, Arkansas, and have their procedure
Right.
done and never miss a lick.
Perfect. So as far as different types of skin treatments, name some skin treatments that we do need to prep the skin for in medical aesthetics and dermatology. What are we referring to?
Well, there's no question, anytime you're breaking the surface of the epidermis, in other words, if you're doing a microneedling, you're going through that epidermis. If you're doing a chemical peel, you're removing a part of that. On the other hand, if you were doing a skin tightening procedure or an ultrasound or things of that sort, it's not as important to have the skin prepped as it would be if you had an opening where bacteria can get in.
Right.
In other words,
So,
adverse
right.
reaction.
So skin tightening referring to like radio frequency,
Right.
ultrasound as
Right.
such. But if we're changing the epithelial cells, the epidermal layer of the skin, then we need to prep the skin. So how can, well, first of all, let's talk about ingredients regarding pre and post care. Specifically, Dr. B, what are your thoughts on retin A and prepping the skin?
Well, retin A is retinoic acid, would be the
Right.
chemical name. That's a derivative of vitamin A. And to get a result with retin A, you need a percentage that's a high enough percentage that it irritates the skin. So you get some flaking, some redness, and some discomfort. There is no permanent result from using retin A. And some of the bigger companies wanted to get a name recognition for using a retinol sort of product. So the FDA allows them to use a very low strength retin A ingredient and call it retinol without a prescription. And it does essentially nothing. Well, it's highly profitable for the company. That's the only benefit that I can see from it.
Okay, perfect.
Our system evolved at about the same time folks were touting the retin A sort of thing. If you have enough dietary ingredient sources from the main nutrients that we need in skin, there's no benefit added from retin A to the system that we developed. And that's because we use the primary mediator of our skin's immune system in the 10% lactic acid in our fruit acid.
Perfect. Yes, makes sense. So the other ingredient that we need to talk about in regards to prepping the skin is hydroquinone, also known as HQ. And so talk about the effects of hydroquinone, and also let's talk about how Enlighten, the Theraderm product, is different in regards to how it works in the skin versus the hydroquinone when you're prepping this.
Okay, well, hydroquinone is the chemical name that's used for that product. There are a number of different prescription products available that contain hydroquinone in 4% or greater concentration. Below 3%, you don't need a prescription for a hydroquinone product, FDA sort of thing. Above 3%, you do. And that all comes from the origin of using hydroquinone on skin to lighten pigment cells came from observations by a dermatologist over in Africa in the rubber plantations, where the folks doing the actual harvesting of the rubber tree sap, kind of like we maple syrup. We, make an incision in the bark and collect the juice. Well, they'd collect this rubber plant juice and put it in a vat and stir it for 3 or 4 day period of time. And of course, in Africa, it's a hot country, so it was usually dark-skinned men with no shirt on out there in the sun stirring these things. Well, they noticed that all of them that had worked there a year or more had white skin from the elbows down. And the dermatologists were extremely impressed with that, because something had caused the pigment to go away or to be suppressed. And they did some studies and they did some tests. Well, in their tests, they applied the hydroquinone in 2, 3, 4, and 5% to the shoulder blade area. And all of those that got the hydroquinone greater than 3%, instead of staying in that square that was outlined that they painted, the white lightning, the white color, the lightning of the pigment extended out past that. So the FDA said, well, you can't put that in a product without it being a prescription, closely watched. But hydroquinone is actually a derivative of tyrosine. Tyrosine is one of the building blocks in our protein system. And you can get permanent defects from using hydroquinone, and we can get the same effect from using 2 ingredients. L-arbutin and kojic acid come from plant sources, and combining those 2, you get the double whammy effect equivalent to the lightning that you would see with 4% hydroquinone. So we quit using hydroquinone 10 or 12 years ago when we were able to formulate something that worked just as well with no downside.
So talk about the science of that. So the hydroquinone, in regards to tyrosine inhibitors, is it blocking it?
Well, hydroquinone, yes, blocks the formation of pigment from tyrosine going through a series of chemical steps. It prevents it from progressing on to melanin pigment.
Okay. So it blocks it. And then if we combine what's in the Enlighten project, which is kojic and alpha arbutin. Okay.
L-arbutin, right. Anyway.
Does it communicate and tell it how to function, but still makes it to the surface?
It evens the production process in the skin. So if you have patches that are dark and patches that are light, like an irregular pigmentation, it evens out the melanin production to the same in all those areas. So you get an even complexion. You could take one, if there's just one dark spot, if it's in the epidermal melanin producing cells, melanocytes, you could treat just that spot. But that's only one small area of the very usefulness of the Enlighten.
Right. And we want to create overall even complexion.
Yeah.
Right.
You want to be young all over.
Yes, exactly. Great information. So that's talking about ingredients. Let's go back to the steps of prepping the skin and talk more in a scientific manner of what each product does and why we need that to happen. So we have, it looks like, yes, perfect. They read my mind. Thank you, Christina. So we have on the screen here, if you all can see, the prepare system. And in the kit, you get a 2-week supply, because we just learned via Dr. Beckman that we need to prep the skin for 2 weeks prior to treatment. And the kit includes cleanse, exfoliate, brighten, repair with OPC, and the renew with the Eternox peptide cream. So talk about what these products are doing, Dr. Beckman, in a scientific manner. As far as what the skin's doing, we're balancing the oil, we're creating that communication, but let's tell our audience more in a scientific manner what that's doing.
Well, a good point for that. If you look at things stepwise, the way you use these products on a daily basis, there's a reason the cleanser comes first. If you're going to put a new finish on a piece of furniture, you got to take the old stuff off. You got to get it down to raw wood before you can put a new stain or a new varnish or a new anything on it.
Right.
The cleanse and wash formula that we came up with, it was my 18th prototype. And over a year-long period of time back in the late 80s when I was developing this, I wanted something that was gentle enough that if I got it in my eye, it wouldn't burn. So I could use it post-operatively on my facelift patients or eyelid surgery patients to clean their surgical wounds. So it cleaned all the junk off that shouldn't be there from the
Right.
procedure itself. And it also removed excess oils that were there that would prevent any other products that you wanted to put on the skin, whether it was an antibiotic ointment in the case of surgery, or whether it was a cosmetic product that you wanted to get an even coloration. So the cleanse and wash was the first step. And then the fruit acid, the exfoliation step, and I think we'll be able to pull up a picture after a while that shows what happens over a very short period of time if you use lactic acid 10%, which this fruit acid exfoliant is, on skin. That gets rid of that rough external surface texture that skin has. We call it basket weaving if you looked at a microscopic image of it. And in the process of doing that, it increases the cell turnover time in the basal layer from about a 13-week period of time in a 60-year-old person back to about a 2-week period of time. So it's totally replacing itself more rapidly. It's like polishing your car. It's like putting a new coat of paint on your house. It just freshens the whole process up. So you've done that part. The enlightened part of it is actually to even that melanin production across the skin, because we know in this particular system we're preparing the skin. We call it the prepare system because we're going to do something that injures the skin, and we want it to be evenly healed, if you will. Then the repair section, the OPC reparative serum, actually has a number of antioxidants in it that aren't combined in the same, you'd have to use 3 or 4 different other brand products to get the same concentrations. And that's all in a water base, so it goes easily into the skin after you've cleaned and done other things. So the reparative serum includes lipoic acid. Lipoic acid is made in the liver in very small amounts, but it's so powerful that if you gave lipoic acid IV to a person that ate a poisonous mushroom that normally would kill them in 24 hours, they're totally well in 24 hours. So we thought, gosh, if it's that good an antioxidant, I want some on my skin.
Absolutely.
And then when you've done those things, when you've really washed and cleaned and rubbed and scrubbed and done everything else, we've removed some of the normal skin oil that's there. And excuse me, we used to hear comments from plastic surgeons and dermatologists that said, well, you're taking some of the skin oil out. You're going to have dry skin. Well, not if you put it back and put it back in a better way. So we developed 3 different moisturizers. This particular one has 3 different peptides in it that give it an actual working effect from a regenerative and healing effect. The peptide that's unique to us is covered by 31 patents, and we're the only skincare company allowed to use that ingredient in a skincare product.
Amazing.
You might say, well, how'd you get those patents? Well, I didn't get those patents, but I spent 2 years in plastic surgery residency with the plastic surgeon that owns those patents, and he's used Theraderm in his office for 30 years. And he said, Jim, I'll let you use this, but nobody else can use it for skincare.
Perfect.
He actually developed it for Brooke Army Hospital, military hospital that treats third-degree burns. It actually causes skin to grow where there's no skin there.
Yes, which is perfect, utilizing that during or post-procedure as well, immediately, possibly during a chemical peel. If you're doing the clarifying peel, you apply the peptide cream on to calm and soothe the skin immediately. So let's just recap what you went through. I want to make sure everybody understands the functions of the Prepare system. So the cleansing wash is going to be our first step. And of course, this is just to cleanse and to remove any of the debris that's present on the skin. The fruit acid exfoliant, the main ingredient in that, as Dr. B said, is the 10% lactic acid. And this is a great opportunity to talk about why he believes in 10% lactic acid versus the glycolic acid, and what the difference that it provides to the skin in regards to the effects, the results, and why. So talk about in regards to the carbons, how lactic acid is 3 carbon, glycolic's 2, how lactic acid lives in our bodies. Tell them more about that, the power of that product.
Well, lactic acid is more than just living in our body. We have a patent pending for a method to prevent aging in skin, and it's due to the action of lactic acid taking external energy from the sun. The UV light that we get every day is what makes a 13-year-old child look 60 when they turn 60. That's daily, cumulative, chronic UV exposure. And we're doing a study right now at the University of Arkansas in their biomedical engineering program with mice and UV light that shows mild sunburn each day. And we're showing that we're redirecting that sun energy into stored chemical energy rather than free radicals that cause the damage to DNA and cell walls and protein, so on and so forth. So that's a unique thing that's going on. We're using the fruit acid for the exfoliation part of it, but we're getting the side benefit that we're protecting the skin at the same time.
Right, because of the functioning of the lactic acid that's in the fruit acid.
Now,
And
the other thing about that, you mentioned 3 carbons, that is lactic acid. Glucose is the fuel we run our bodies on, and it's a 6 carbon molecule, and it splits into 2 3 carbon molecules, and those end up as lactic acid, and in the cell that lactic acid is metabolized that's where our energy comes from. Glycolic acid is also an alpha hydroxy acid, but the body can't metabolize it. It ends up in the kidney as crystals. I know of one patient that had a 70% glycolic acid peel. That was a kidney transplant patient, and it knocked her kidney out. So that's another 5 years and $500,000 to get a second transplant. Can't happen with lactic acid.
right. And is this product, the fruit acid exfoliant, safe for all skin types?
It's safe for all skin types. It's even safe to use during pregnancy. A lot of women say, "Oh, I can't use my skincare product for whatever brand X." My doctor said I'm not to use any skincare products. Well,
Right.
this is actually helping their skin at a time when they really need all the help they can to prevent stretch marks and all the other things on their tummy.
Perfect. So let's talk about the Prolong system, which is the post-care that we offer for our clients, and the importance of post-care. So tell us about that, Dr. B, real quick.
Well, if you're doing a peel or a procedure that excuse me, is going to cause some, I call it fish scales. In other words, some rough surface to skin after the procedure, because it's really exfoliating at a more rapid rate.
Right.
We use the new peel, which is an enzyme peel. It's totally natural enzymes that loosen the glue holding those fish scales down, so that as you gently rub your fingers over your facial skin or wherever your peel was, it becomes soft and smooth, and you can easily cover that skin on 2 days after a TCA peel with a mineral powder makeup, and there's no downtime. I mean, there's healing time, but you can still go to your job if you're a secretary in an office, or you can
Right.
go to Walmart and go shopping and not have 900 people watching you go down the aisle with that red, flaky fish scale face.
Right.
So that's key for the one. The new peel has no irritation effect. It actually has 21 micronutrients in it that are helping the skin to more quickly heal
Right.
afterwards.
And they start the post-procedure kit when?
Well, actually, the first 24 hours, let's say you do a chemical peel or a procedure in the office that's going to have some flaking to your skin at 3 o'clock in the afternoon. The next morning's probably a little bit early, but if you've got real thick skin and it's, you know, a Jessner peel that's not as deep as a 30% TCA peel, you can start as early as the next morning.
Perfect. And then the steps we go through, of course, the most imperative is going to be the new peel natural enzyme, cleanse, exfoliate, brighten, repair, and of course the renew. And this is going to last them 2 weeks as far as their post-care is concerned. And during that post-care, the main important factor is that we're healing and stabilizing the skin to prevent post-procedure complications.
Yeah, and these are the same products. If you think about it, these are the same products that they're going to continue to use the rest of their life. So that they're getting a sneak preview of how good something can feel, and they're seeing the results in a 2-week period of time that tells them, I ain't going to use anything else ever on my face again because I love the effect that I'm getting from this. The last step in this particular system, the Eternox cream, is really going to set them apart in that particular combination of peptides. We did a 12-week study with 60-year-old women with neck skin laxity, used the Eternox cream for a 12-week period of time, and they saw a 40% reduction in the laxity. That's the loose skin in your neck. And they saw a 68% reduction in fine lines and wrinkles. And that's with no surgery, but the effect of a facelift. So why not put something on skin every day that keeps you from having to have an $8,000 facelift?
Exactly. I will take the products all day long. So the best part is that we're able to make the pre and post care simple, easy, effective, affordable with these products in the kit that we have. And we've learned as we recap the importance of preparing the skin before the treatment and the importance of the post care. So thank you so much, Dr. B, for the training today and your time. I will let Darla or Christina pop on and let's answer some questions that you guys have sent us.
Right. Hi, everybody. Thank you so much for joining us today. This has really been great, really wonderful information. I think Darla was going to take the questions. She was going to answer them. So Darla, unmute yourself. You're muted. Still muted.
Okay.
Awesome.
Sorry. Okay, we had a question from one of the participants that wanted to know, Dr. B, you probably need to answer this one. Can you use these products while going through chemotherapy?
Good question.
Yes, as a matter of fact, the products that are in this system are for wound healing. In other words, a procedure that way. Chemotherapy is wounding, but it's systemic. It's from the inside all the way around. Normally, what a person would do that's on chemotherapy would just use the Theraderm system. A travel size system is a 2-week period of system that would do the same thing without the enlightened part.
Okay.
Did you hear my dog bark?
Yep. We heard the dog barking. He wants lunch.
Yeah, lunchtime.
Yes. Okay. So it is safe for them to use. And we do have a couple other products too when people are going through chemotherapy, radiation, that also helps with the dryness of the skin too, that we have in our lines. So that's pretty much all of the questions that we have. And if, wait a minute, I've got one more. Can the post system be used post laser resurfacing?
It can be used after any procedure, period. And laser resurfacing is energy that's going into the skin. And this research that we've been doing, we did a study at Vanderbilt with thermal energy. In other words, a true, like a curling iron burn. You put the fruit acid on that and the pain stops, the injury symptoms reverse themselves. And with radiation therapy or with laser therapy, you don't have to go through the healing time from all the burn aspects of the procedure itself. So sure, yeah, go for it.
Okay. Would they hold off on the fruit acid for like a day after the laser resurfacing, or just go ahead the next day and start with it?
Well, that's, you know, how thick is the slice of onion that you peel off? That's kind of what it goes down to.
Okay.
Laser is a general term for light activated energy, and some laser resurfacing is deeper than others. So I would say if there's no epidermis, wait a day or two to let that start to re-epithelialize before you use it. But most laser procedures are going to be able to be used with any of these products.
Okay. There was another question that about acne. With these pre and post getting, would you use the pre and post to help with the acne, or would you more or less start them on the acne line?
Well, with acne, I like to do a Jessner peel, first of all, if they have active pustular acne, so you can unroof those and let the gunk stuff get out. So you've created small, multiple little wounds where those acne pustules were, and yeah, you want them to heal at the same time. So sure, using the pre and post procedure, if you're going to do a Jessner peel, whether it's for acne or rough skin or melasma or whatever, yeah, go for it.
But on the, if you're using the acne products, if they're going to do a Jessner's, would you advise them to wait at least 24 hours before, not using the reversion products before a Jessner's, and maybe just use the fruit acid part?
Yeah.
Or
yeah, the same thing would be true if you're using other ingredients from other lines. A prescription retin A, for instance, you ought to be off of retin A for at least a week before you do a chemical peel.
okay. Next week, we are going to do a Zoom on lactic versus glycolic pills. So we will start kind of getting into the different pills that we do. So we will have another Zoom next week on pills. So you'll need to tune into that. There's one more question we'll try to answer real quick. Is there a certain age on kids, or any age, if they have acne, that you start? I don't, you know, is there a certain age that you would say not to, or?
Well, acne usually doesn't start to manifest itself until hormones start doing their crazy stuff at 12 or 13 years old. Some young women start having ovarian estrogen changes at an earlier age than that, but usually about 13 years old is when we'd start to see acne. And if you can catch it in the mild stages before it leaves moon crater scars and things of that sort, the earlier the better. If you've got acne, start treating it.
Okay. Okay. All right. That looks like all of the questions we have, and we're trying to keep it at 30 minutes. If you guys do have any other questions, Christina popped my email up there. Feel free to email me and I will get your questions answered. Also, if you have any needs for training, Bri does training on dermaplaning, microneedling, advanced chemical peels. So get with me and I can get you her information on peels. If you are new to our line, send me an email and I would love to talk to you about getting some of our products and what would help you in your business. And I think that's it for us, but we will be back next week. And like I said, it is going to be about lactic versus glycolic pills.
Perfect.
So
Thank you, Darla.
Everyone.
thank you guys.
Bye.
Bye.
Bye. They actually used prisoners that were unpaid labor other than an extra hamburger on Saturday or something of that sort. In other words, dark complected, either Hispanic or Negro patients.